This is extremely important for the practitioner and as a goal is to reduce the treatment time, avoid premature loading, establish more predictable outcomes. And the thing is that it will help us to determine the proper healing period, proper loading protocol. Do we go to immediate loading or delayed restoration? So it's good to be on the safe side, because if you go to a fixed restoration, immediate loading, and is not, the ISQ is too low, you may lose the implant, lose the bridge, and the patient was supposed to have the tooth in 1 day will end up having the tooth in 1 year, because you need to regraft, wait with a removable, wait for integration, and then this is a dramatic change. So this ISQ scale will help us to reduce the scale, treatment time, avoid premature loading, provide predictable outcome, determine loading protocol, such as delayed, early, or immediate loading. So I use this in my daily practice every day. I want to be safe. I want to be sure. I think this is so easy to use. I don't understand why we shouldn't use this. Because when you get such a value 75 to 71, we're going to discuss on the values. This is extremely important. You know that you're on the safe side to construct a restoration.